Guys, we are back here with Dr. Jason Smith, physiatrist here at Atlantic Health, home of Atlantic Sports Health. And, we're talking about lower back injury, specifically disc bulge. And we talked about the difference between disc bulge and disc herniation. Doc, if you can go over that and give some of us analogies, and what's the difference between a disc bulge and a disc herniation, and also, what is a disc and how does it work in the spine? We have a great model here that maybe you can kind of share.
Sounds good. So, we'll start back with the basics. So a disc is basically like a pressure relieving system that sits in between our vertebrae within our back, whether it be in your neck or your lower back. Over time, as with anything, it starts to get worn down, beat up, and start to get aspects of wear and tear. So that's where you start to come in with the terminology of disc herniation, disc bulge, disc extrusion, things of that nature. Disc herniation truly is an umbrella term that encompasses any type of change to this disc. So dealing with the most minor of them is a disc bulge. A disc bulge means that the annulus fibrosis, which circles around the center of your disc, and in the center of your disc is really a gelatinous material, the nucleus pulposus. That is still intact, but you have a little bit of an outpocketing. So the example I like to tell my patients is, just pretend you're looking at a car tire and you see a little bit knuckleball right there on the car tire.
Yes.
The tire is still intact, but there's a weakening in the wall of the rubber. So that's similar to a disc bulge.
And I love the analogy, the car tire, and here's why. The car tire, the tire itself is the actual disc,
Correct.
the annulus fibrosis, right?
Yes.
The rim is the vertebrae.
Correct.
And the air inside, the air is really the nucleus pulposus. Now, that's
Correct.
air, but it would be a liquid type of
Correct.
material. So imagining stacking, 12 car tires on top of it,
Absolutely
and that's
correct.
your vertebrae,
That is
right?
correct.
And then that rubber is that annulus, is
Yes.
that fibrous connective collagen tissue that wears down over time due to age and poor posture.
Absolutely. So now if you take that a step further, once the annulus fibrosis has been broken, or the wall of the tire has been broken, you start to get seepage of some of the gelatinous material outside, and that's where you get an actual herniation. And as that increases in size, that's where you change the terminology to an extrusion, which I tend to use an analogy of picture the jelly coming out of a jelly donut. It's either running up or down the donut. And then you also have what can be called a disc fragment, where some of that jelly has now broken off and is kind of free floating around that spinal canal and causing significant discomfort.
Wow. It's interesting because our tires, unfortunately, do wear out, right, on our car, and those car tires around our spine,
That's right.
which we're talking about here, do wear out. I think, we mentioned some things that, how do you prevent that? How do you slow that process down, right? Core stiffening, core strengthening, stretching,
Correct.
keeping the resiliency of the spine. Why don't you share a few things that you recommend your patients?
Sure. So, sticking to our analogy subject of automobiles, talking about core strengthening, I usually compare a patient's core to like the roll cage in a car, where if you have a car that's just flimsy, God forbid it was to turn over, everything is rolling around it, it's torn apart, it's really traumatic. Whereas in the sports cars that really have that iron case around it, people can flip around in it and walk away with just a couple of scratches, and so that's very similar. So, core stability in every patient is key. Doesn't matter how big or how small you are. Obviously you don't want to carry around too much excess weight because that puts a different type of pressure on it. But you can be 120 pounds, have a weak core, and have a horrible back.
Right. Right.
I've also seen, individuals who may have been a little stockier than others, but their core is tight and they may have some back discomfort, but overall it's easier to help those patients.
Sure.
Because their back isn't in as bad as position. So.
I love the analogy, the roll cage, right? I mean, when you look at those racing cars and they're so strong, keeps everything intact, keeps that driver safe. Well, that's your core. So that roll cage is made of steel,
Yes.
right? And so we have to create a steel strong core to help support our spine. I like also the analogy of the big, huge, 100, 200-foot antennas that stand up straight up, that are unique, I think, radio antennas that have these guy wires all around them, and that antenna is the spine, and the guy wires are all the core muscles that help stabilize that spine. So to keep those car tires healthy in your spine, that stack one another, that annulus, and keeping from disc bulge or worse, disc herniation. Keep that core strong. Take advantage of, doing core stiffening exercises. Those are really important, right? I mean, because I know crunches now, it's been proven that the crunch is not a great exercise because it puts us in flexion, and we don't want to do that.
Correct.
Yeah. So guys, thanks so much for joining us. Dr. Smith, thank you so much. Great explanation, great analogies. Hopefully this gives you a better insight on having a healthy spine.